Consortium from 2016 till date. Dr. Ayodotun Bobadoye is an associate professor of environmental biosecurity at the Forestry Research Institute of Nigeria, FRIN. He was also a research officer at the African Technology and Policy Studies Network, ATPS, Nairobi, Kenya. He is a scholar of the Woodrow Wilson International Center for Scholars, Washington, D.C., and a scholar of Africa Science Services Center on Climate Change and Adapted Land Use, WASCAL. He has led many internationally funded research projects bordering on biosecurity, One Health, climate change science, technology, and innovation, STR, innovation systems, development issues, policy development, analysis and advocacy, epidemiology, and private sector engagement. He is a member of many professional organizations and has published over 60 articles in reputable journals. He will be speaking with us on understanding the link between climate change and global health security. Dr. Ayodotun Bobadoye, please take it away. Thank you.
Good afternoon, ladies and gentlemen. And thank you, Boega, for that very kind introduction. Let me start by thanking the first two presenters for those wonderful presentations, especially my boss, Professor William Ogara. For those that don't know Professor Ogara was my PhD supervisor at the University of Nairobi some 6-7 years ago. And it was very kind working with such a kind man like that. A lot of things I've come to learn and good habits I exhibit in the area of research today. I learned it from Professor Ogara. And the things that are not too good, maybe they are the things that he was not able to correct before I left Nairobi. So Professor Ogara, it's nice sharing this platform with you, and thank you for everything for your support when I was in Nairobi. I say Asante Sana. So today I'll be speaking, let me just go back. I'll be speaking on the link between global health security and climate change. And the truth is that in our world today, the cycles of emerging infectious diseases and cycles of pandemics and epidemics are reducing. And we are having increase in the frequency and intensity of emerging infectious diseases like we've never seen in reported human history. And the world is coming to an era that we can term the epidemic era or the pandemic era, whereas we are moving from one epidemic in one part of the world where we are getting to another epidemic or even pandemics. As now, it's not a matter of if you're going to have another one, it's a matter of when is the next biosecurity threat going to happen. So now, the world, nobody is safe until everybody is safe. And a small disease outbreak in a very small area, let's say in Samburu in Kenya, within a very short period of time can become a global issue. And that brings us to the issue of global health security, understanding clearly that health issues are now global issues, and we have to effectively tackle health emergencies, especially biosecurity threats and infectious disease outbreaks together to ensure that the whole world is safe. The World Health Organization, the African region, reported that every 3 days an acute health event is reported, and about 80% of these reported health events are infectious diseases, and a lot of them are zoonotic in origin. What is that telling us? It's telling us clearly that almost every week now there's something, an infectious disease outbreak or zoonotic disease of zoonotic or animal origin occurs somewhere in Africa. That shows the rate of frequency of emerging infectious diseases on our continent. And let's look at some of these diseases, the COVID-19 that we are currently battling with, that within a short period of time of 2 years, started in a small town called Wuhan in China. And within 2 years, it has been reported in every country and territory all over the world, affecting over 400 million people as we speak, and led to the death of about 6 million people, not to talk of the impact of COVID on the economy of the world. Other infectious diseases like dengue fever, Ebola, and other emerging infectious diseases, we've seen increase in their frequency and intensity in recent years. Take, for example, Ebola that was first identified in 1976. And between 1976 and the year 2021, we have 25 recorded outbreaks of Ebola in Africa. But you notice that out of those 25, we had like 17 of those 25 outbreaks were recorded between the year 2000 and the year 2021, especially the one we had in West Africa between 2014 and 2016 that led to the death of about 13,000 people and almost crippled the economy of the whole region. Another emerging infectious disease that increases is dengue fever. Dengue fever before 1970 was recorded only in 10 countries in the world. But as we speak now, WHO reported last year that dengue fever is now endemic in over 100 countries in the world. So that shows the increase in the frequency of emerging infectious and re-emerging infectious diseases. And it shows clearly that nobody is safe until everybody is safe. And a small outbreak in a very small, minute area within a short period of time can become an outbreak all over the world. And that is where the issue of global health security comes in. Understanding that to effectively tackle modern health challenges, to effectively tackle modern disease outbreaks, infectious disease outbreaks, to effectively tackle modern epidemics, we have to use a global approach. There's no way a country, there's no single country, no single sector, no single region of the world that can effectively address the global health challenges that we are having today. And there is need for international collaboration and international agreements and treaties to effectively make sure that the world is safe and the world can effectively tackle emerging biosecurity threats and increasing epidemics and pandemics that we're having. So what is global health security? In a nutshell, it is the work improving our public health ability. Is the existence of a structure or a system that can effectively prevent, dictate, respond to, and report infectious diseases anywhere it happens all over the world. So the world should be prepared for infectious disease outbreak anywhere in the world and be able to effectively detect and respond to it and report it so that a small disease or a small infection like COVID will not end up being a global issue within a short period of time. And we have international frameworks and international treaties and agreements that have been agreed by countries all over the world to ensure global health security. And these international agreements are dovetailed into regional agreements, and countries introduce them into their national policies, and we have implementation at the local level. Some of these international policies include the Global Health Security Agenda, the Biological Weapon Conventions, the Resolution 1540, International Health Resolution, and other international treaties, all set together to reduce the impact of emerging infectious diseases, outbreaks, pandemics, and epidemics in the world. Let's look at some of these international treaties. We have the International Health Regulation, which was first adopted in 1969 and was reviewed in 2005. And the whole essence of the International Health Regulation is to prepare an international understanding and regulations to build the health capacity and the capacity of countries to effectively respond, identify, respond, prevent, and report outbreaks in their country in anywhere in the world. So the whole essence of international health regulations that have been agreed by the 196 members of WHO is to build the health system, public health systems of countries to effectively prevent, protect, dictate, and respond to international disease outbreaks, especially of international concern within a very short period of time. And there are frameworks and monitoring and evaluation systems that have been set in place to make sure that countries have the ability to review their public health policies. We have like the JEA, Joint External Evaluation, that countries can use to evaluate their health system and know where they stand when it comes to public health preparedness. And international health regulations have its components, the scope that covers any public health emergency of international concern, the mode of communication through the national focal points, the notification to WHO, and the process that goes between disease outbreak and response and communication to WHO for action and other activities. We also have the Global Health Security Agenda. Global Health Security Agenda was brought together in 2014. Once they are standing clearly that there is no country, no sector, and no particular group of people can effectively tackle the emerging health challenges that is facing the whole world. So countries all over the world, we have about 70 countries now, non-governmental organizations and international organizations came together and formed the Global Health Security Agenda. And the vision is clear: to attain a world safe and secure from global health crisis posed by infectious diseases. So the Global Health Security Agenda is a transdisciplinary approach, bringing together countries, non-governmental organizations, and international organizations to effectively tackle the issues of infectious diseases that's affecting different countries or that may affect any country all over the world. And it uses a One Health approach in its agenda. It has 11 package to prevent, to detect, and to respond to any health emergency, infectious disease outbreak anywhere in the world. And we can see the 11 package on the screen. We also have the Biological Weapon Convention, the Biological and Toxin Weapon Convention, the BWC, which is the first international treaty that prohibits the production, the stockpiling, and the use of biological agents as a weapon of war. And countries all over the world have agreed to the Biological Weapon Convention, identifying clearly that with increase in terrorist activities all over the world, there's an urgent need to set up international treaties that will prohibit countries from stockpiling, from producing, from acquiring, and using biological agents as weapon of war. And he has his own articles from Article 1 to Article 10. And the Article 4 of Biological Weapons Convention states clearly that each state party of the convention shall make sure that countries or within its territory we don't have production, processing, development, acquisition, retention of biological weapons within its territory. So what are the main global health security risks that we are having today? Include the emergence and spread of new infectious diseases, which we've discussed, the ever-increasing globalization of travel. Today, about 3 million people travel by air all over the world. So, and as human beings move from one end of the world to the other, they carry their loads, they carry their baggage, they carry the good, the bad, and the ugly. And the ugly may include diseases that they transmit from one part of the world to the other. You have the issue of antimicrobial resistance that is ravaging, becoming one of the biggest health issues in the world today. I have the potential of using biological agents as a weapon of war, especially with increasing terrorist activities in major cities and major countries in sub-Saharan Africa. And the one we're focusing on today is climate change and environmental degradation. The truth is that the climate of the world is changing. And the present climate change we're experiencing is as a result of human activities releasing greenhouse gases into the atmosphere. And this chart shows clearly how the global temperature is increasing from pre-industrial period to our world today. And research has shown that the average global temperature is increasing at about 0.2 degrees every decade. And now the global temperature has increased by over 1 degree, about 1.2 degrees from pre-industrial period to the year 2021. And what is the impact of climate change? What is the link between climate change and health security? the earlier speakers have spoken so much on this, and I wouldn't like to flog this too much. But research has shown clearly that a warmer world may most likely lead to a sicker world. Climate change, as it increases global temperature, we've started seeing emergence of diseases that usually used to be tropical and subtropical diseases in areas that were relatively cold. Like dengue fever that I said, dengue fever is caused by mosquitoes, usually used to be subtropical and tropical diseases. That we are now seeing emergence of dengue fever, emergence of malaria and other subtropical diseases in relatively temperate area because of increase in temperature that is making the environment relatively conducive for the vectors to survive and to transmit such diseases. One of the biggest challenge or the biggest link between climate change and global health security is the issue of migration. Climate change leads to extreme weather events such as forest fires and flooding and all those kind of things affecting the habitat of both humans and animals. And as we all know, the forest is a natural habitat for dangerous pathogens that human beings know nothing about. Wild animals carries a whole lot of virus and different pathogens, thousands and hundreds of thousands of them that human beings know nothing about. And as climate change continues to affect natural habitats of wild animals and human beings and other forms of organisms, it leads to continuous migration of both human beings and animals. And as we continue to experience migration, we see increase in contact between human beings and animals, either through the food they eat, animals having access to our food, or through the water we drink, or even through direct contact. And as we see increase in contact between wild animals and human beings, there's an increase in possibility and probability that pathogens will jump from the wild world, from wild animal world into human world. And the recent increase in zoonotic diseases all over the world has been attributed to some of these increase in contacts between humans and wild animals. A typical example is the increase in frequency of Lassa fever in West Africa as a result of rodents finding their way to getting closer to human habitats, getting closer to human houses, having access to food and water than human beings in West Africa take, and increasing the transmission of Lassa fever in the region. Another big example of impact of climate change on global health security is the melting of the ice, permafrost. The truth is that the Antarctic, the ice of the Antarctic is melting 3 times, or the temperature of the Antarctic is increasing 3 times more than the average global increase in global temperature. And as the temperature of the Antarctic ice increases, and we see increase in melting of these ices, the ice naturally is a natural storage system for microorganisms and viruses and other pathogens that we know nothing about because of the temperatures of the ice, because of the low oxygen content, and because it's relatively dark. Research has shown that microorganisms and pathogens and viruses have the ability to survive in the global ice and permafrost for years and decades and hundreds of years. So as melting of this permafrost and ice increases, it can lead to a release of pathogens and viruses that human knows nothing about into the system, and we start seeing emergence of new emerging infectious diseases that human beings don't have clear understanding of what they are. So these are serious issues and serious ways climate change can have severe impact on global security rates. And another issue that is the issue of air pollution. Preliminary research from COVID showed clearly that in cities and countries that are highly polluted, there was increase in the frequency, the spread, and the intensity of COVID. And scientists are beginning to relate the spread of airborne diseases and viruses to increase in pollutants, and pollutants having the ability to help spread viruses and diseases in different parts of the world. So these are issues with climate change and global security. And what is the solution? The truth is that man can no more live in isolation of his environment. And for us to effectively address the issue of climate change and the issue of global security, we have to look for an holistic transdisciplinary approach to it. And the holistic transdisciplinary approach we can consider is the One Earth approach, bringing together, looking at health in an holistic matter, and bringing together the health of human, animals, and the shared environment that we have. One health concept becomes a clear and an integrated approach to address the issue of climate change, at the same time addressing the issue of global health security affecting the whole world. Finally, let me talk about enhancing health security in Africa, because climate change showed clearly that when the whole world is having challenges, there's this issue of me first. Me first is, let me settle my country first before I see what I can give to others. And climate change or COVID showed clearly how fragile international treaties and international laws can be when we have global challenges. And it's very important now for African countries to develop African systems and a public health system to effectively address biosecurity threats and emerging diseases on the continent. I listed some things that we can do in Africa here. We have to strengthen our public health institutions, invest in research and development, strengthen public health workers, build capacity of our workers, we have to develop respectful local and international partnership, and we have to develop an African pandemic treaty. We have to develop how African countries will address African issues. These are very important. Finally, I talk about my organization, GET. It's one of the biggest biosecurity and One Earth-based organizations in Africa. We conduct research in the area of biosecurity, One Health, and climate change in different countries in Africa. We run the GET One Earth Journal of One Earth and Biosecurity, which is the only African-based journal that is focused on biosecurity and One Health, and it's absolutely free. The next edition will be coming out in March, and if you have papers to submit, you can still submit to us. And we're planning to start the GET Institute for Biosecurity very soon, before the end of the year. And finally, I'm inviting you to the 8th African Conference for One Earth and Biosecurity. I'll be coming up in Lagos, Nigeria, between the 26th and 28th October 2022. It's usually one of the biggest gatherings of biosecurity experts on the continent, and please, you can't afford to miss it for anything. Thank you. Over to you, moderator.